A soccer goalie dives for a ball and hits his head on the goal, making him go unconscious. An athletic trainer arrives at his side and gives a verbal stimulus to try and awake him. Next, he goes for a painful stimulus, which awakes the patient. The athletic trainer finds out that there is neck pain and midline tenderness. This causes him to immobilize the cervical spine and stabilize. Calling for a second athletic trainer, a secondary assessment is performed and a distracting injuries test is also performed. This means that pressure is applied to the face, extremities, and abdomen to check for any injuries, severe bleeding, or dislocations and fractures that could need treatment before cervical spine immobilization and transportation. Motor function and sensory tests are completed on both sides of the body to assess for any potential spinal cord damage. A third athletic trainer is then used to assess vital signs and assure that organs are working properly and not going into shock. At this point, a fourth athletic trainer is used to call EMS and give them any information they could need, including the location, the age and name of the victim, as well as what type of injury has occurred. After the motor function test and vital signs are taken, the head athletic trainer in charge of the situation calls for a spine board. The fourth athletic trainer retrieves the spine board after writing down the vital signs. The spine board is retrieved and all straps are removed out of the way, as well as head blocks taken off to ensure that the victim can be placed on properly. A group of trained professionals regarding coaches, possible other athletic trainers, and other people on the athletic training staff then begin the process for a lift onto the spine board. Again, all straps are moved out of the way to ensure that the athlete can be put on properly. The head athletic trainer then commands each person on what to do. He specifically tells each person where to be situated along the body. Specifically, there should be 2 people at the shoulders, 2 people at the pelvis, and 2 people on each side of the legs. The arms are crossed over the abdomen, and the legs are placed together. The head athletic trainer instructs each person assisting the lift to cross their hands underneath the body. He then asks if anybody is not ready. After asking this, he counts to 3 and the lift begins. The lift is about 4 to 6 inches off of the ground so that the spine board can fit underneath the patient. While there's a head athletic trainer and 6 other trained professionals lifting, a 7th trained professional is at the end of the victim, sliding the backboard underneath. Before placing the patient down, he again asks if anybody is not ready, counts to 3, and lowers the patient. Immediately after lowering, the straps are all secured. A cervical collar is placed on the patient to again help with cervical spine immobilization. You can measure this by using the finger that it takes to get from the chin to the chest. The cervical collar is then measured and adjusted properly. Never letting go of the cervical spine, the head athletic trainer works with the other athletic trainers applying the cervical collar. Once the cervical collar is strapped on, the head athletic trainer resumes stabilizing cervical spine while the head blocks are being secured. Again, cervical spine immobilization is resumed after the head blocks are secured. 2 final straps on the spine board are included on the face to ensure proper immobilization. The cervical spine is immobilized through the backboard, cervical collar, and manual stabilization until EMS arrives and gives other instructions.